And we're back. All right, so now we are going to display how to take blood samples using a vacutainer. So, same things I'm going to do. As always, I'm going to introduce myself to the patient, and I'm going to check the orders, make sure I'm supposed to actually be getting blood samples and figuring out what the samples are going to be for. I'm going to perform hand hygiene, and I'm going to identify the patient. And I'm going to cross-reference the labels that are on the blood sample containers with the patient's bracelet. So it should have their name, their ID number, the site where we're going to be taking the samples from, such like that. I'm going to provide privacy for the patient. I'm going to explain to them what I'm doing and why I am doing it. So I performed hand hygiene. I am going to have a look at their vein. I'm going to help them into a comfy position and ask them if they have preferred place that they like to have this done. Because a lot of people don't like to have it on the back of the hands or certain arm that they prefer to do it on. So whatever the patient prefers, as long as I can find an accessible vein. So then, after I've gotten in the correct position, I'm going to get my equipment set up. So I already have all of my collection tubes that I need. And I have my vacutainer, and I already have it clicked together, so it is ready to go as well. I am going to take a tourniquet, and I'm going to get it on to my patient's arm. And once again, this is going to be loose because I plan on eating this banana at some point. Maybe. I'm not 100% sure. And same thing, I'm going to have these leads going away from the site venipuncture. And I'm going to assess to see if I have any good palpable veins. We're going to have to go a little bit further up than we did in the past time because this doesn't look like a good spot to use anymore. So we have some good palpable veins. So now I'm going to release that tourniquet and make sure that the vein decompresses. And it seems to decompress just fine, so we're going to wait a couple minutes, and while we're doing that, we are going to use cleaning supplies to clean the area. So if I'm using alcohol, I'm going to do it in a circular motion, just kind of moving outward away from the venipuncture site. And I should have put gloves on before I did this. So we're going to backstep it. Put gloves on. Completely. And now we've got alcohol where we're going to clean the area. And since I'm not wearing sterile gloves, I'm going to make sure to not touch that area that I just cleaned again. But I can touch a little bit below it. So I'm going to get my tourniquet tied back on. Nice and tight. Lead's going away. I'm going to assess the radial pulse, and I'm doing that below where I'm actually going to do the check. And now I'm going to take this off my vacutainer. I'm going to hold the skin tight a couple inches below where I'm going to go, and I'm going to advance this with the open side up at about a 15 to 30 degree angle into the vein until I get blood return. So I have blood return. I'm going to use my non-dominant hand to stabilize this, and I am going to insert my first fill. It's all filled up. Do it again. It's all filled up. Do it again. It's all filled up. So now I've got that. I've got gauze pads. As I take the needle out, I'm going to press down. I'm just going to hold that there for a couple minutes or until the blood stops. And we appear to have stopped bleeding, so now I have a nice bandage I'm just going to put over the venipuncture site. And now I am going to make sure that I label all of these appropriately. And now we take them to the laboratory.